In around 470 days, I'll be faced with the most difficult examination in MBBS that is called as National Exit Test or NEXT. It is a substitute for NEET-PG and it is really close and it's kind of scary. So in this video, I'll try to explain my rudimentary strategy on how I'm going to tackle NEXT and what are my current goals and current plans, and more specifically how I'm using Marrow to get to the point where I could revise a lot and in the end hopefully succeed in NEXT. So before we go ahead, what is this National Exit Test? So it is a substitute for NEET-PG that will be happening from 2023. That means the people who are from 18 batch are going to be starting with next examination first. But it could also happen that the 17 batch could come in the same year because they will be as interns and will be as final years, and there can't be two examinations for the same thing in the same year. Anyway, it will be a 3-day examination where on day 1 we'll be presented with medicine and allied courses in the morning, which will be 120 questions, and in the evening we'll be given with pediatrics, which will be 60 questions. On day 2 it will be all about surgery. So in the morning there will be surgery, orthopedics and anesthesia, and in the evening we'll be given with ENT. Always remember, in the morning there are 120 questions and in the evening there are 60 questions, right? And lastly, on day 3, on the morning we'll be given with OBGY, that is obstetrics and gynecology, and in the evening we'll be given ophthalmology. So this is the basic of what the pattern of next is going to be looking like. And after that, we also know is that 10% of the questions from all of this mess will be coming from your preclinical subjects, that is the first year as well as the second year subjects. Another thing is that 10% questions will be coming from community medicine, and finally 60% questions are going to be clinical vignettes or clinical related things, right? Now let us move on to the second part of the video, that is how I'm using Marrow to prepare for next and why is the reason that I am using Marrow apart from any other service. Before we move forward, I'd like to clear one thing. I'm not a brand ambassador for any of the apps. I just talk about what my experience is and what I'm currently using. So I hope that you can use my analogy to whatever app that you have purchased. Right, so the first thing is first, I was All India rank 885 in NEET-UG in 2018. For getting that good rank, I studied a lot and most importantly gave a lot of tests. And I remember giving 1 or 2 grand tests every single day for the past 2 or 3 months of NEET-UG. And that's the single thing which got me to my score. Yeah, everybody was studying, but one thing which was setting me apart was I was giving a lot of grand tests. So what is my current goal for studying, if you ask? So my current goal for studying is getting to the point where I can give a grand test. And how is that going to happen? That is only going to happen when I've completed my syllabus behind. So all the syllabus which I've just talked about in next, at least I have covered 70 to 85% of it. And when I'm done with that, I can be in a capacity to actually give a grand test. I cannot give it now because a lot of subjects, for example OBGY, I haven't even touched, and that would decrease my score by a lot. So the main objective for my preparation currently is completing all the subjects that are relevant right now and getting to the point where I could, I have done the first read and I'm now in the position to give the grand tests. Alright, so let's talk about this concept called as the first read. Let me elaborate more. So in the lockdown, everything was closed and nobody had any access to, clinics and anything. And at that time, what I realized is that I watched a lot of Marrow videos and they provided me with an insight, better than anything I've ever seen before. Even currently, now that I'm studying surgery, the way they teach is, genuinely very simple and easy to understand. Plus, what they have also done is that at any point, whenever you're shown a certain surgery, for example, in ENT, they are showing the videos about how they are performing it. In the end of each video, more or less, they give you a question. They have an interactive Q&A session with you where on the screen it will be displayed what question you're going to have. So what I'm trying to say is that using Marrow, the first objective is to complete all the videos because I'm a 3rd year MBBS student and I have the amount of time to complete the subjects. The videos definitely are a little bit bigger, but the 2x option or the 3x option in Android phones really, makes it easier for me to watch a lot of them in one go. I'll be going over what kind of videos and what kind of speed I'm using later in this video itself. So let's say that I'm done with all the videos and I've watched literally every single subject that there is and every single video that there is. What now? So now, whenever I have to give an examination, I'll have to revise that same subject. But it is not physically possible for me to watch the entire videos again in order to revise the subject. So what I'm trying to say is that if I want to be in the position to revise the subject, I definitely should have my own particular notes which I'll refer to before giving any sort of examination, before giving any sort of grand tests. So my strategy is watching videos and then making the notes. But more specifically, I'm using the printed notes which Marrow already has. What that does is that it decreases the time that I'm spending on making and writing my own notes, and rather it is converting that time to, completely focusing on the video. Because when I'm watching the video with 100% focus, I've seen that my retention increases a lot. However, this can differ a lot person to person. In fact, teachers advise to make our own physical notes, but I'm too alsi for that. They are also active in nature. What that means is that it's just not passively, just watching the lecture and reading the notes. There are some blank spaces in the lecture notes which you have to fill on your own so that you don't lose your attention while watching the lectures. So personally for me, the printed notes were a much better idea. For you, it might be something else. Right, before we move ahead from this topic, I want to tell you my approximate roadmap for completing the subjects which are remaining and what is my current progress on Marrow itself. So for completing any subjects, there can be 3 types of strategies which I can use. So first one of them is slow paced. So slow paced are used for those subjects which can either get boring easily or the subjects which I don't feel like studying right now. For example, the final year subjects which are not currently in my syllabus, I usually do them with a slow pace, and also PSM because it's PSM. The second is the mid-paced. The mid-paced subject is the one in which I can watch 5 to 7 lectures a day at 2 or 3x speed, so that is the tolerable limit for the mid-paced subjects. And last one is the brute force subject. Now what does this brute force subject mean? So brute force, I think, is a word derived from web development, where they attack the site all at once. So it's in the same way that I'm attacking a subject all at once. So a subject ends in like 3 to 5 days. So if you're able to complete a subject in 3 to 5 days, that's the brute force method. So 3 approaches for all the videos in Marrow. Right, so as you can see, I've got a screenshot over here. It says the major subjects are PSM, surgery, medicine, and OBGY. The blue ones are, the ones which I'm currently doing. The red ones are the ones which I haven't touched, and the green ones are the ones which are done. As you can see, PSM is slow paced, surgery is mid paced, medicine is mid paced because I can't really go, as fast because my mind really needs some time to grasp medicine. And moreover, I also feel like I have to read the book of all these subjects, and especially medicine, because it is the compilation of all the subjects that we have studied before. So I'm going to be focusing much more on the book than on the videos. The last one is OBGY. I haven't touched it, so I don't really know what kind of pace it requires. But in the minor subject, the green ones are mostly brute force. Radiology is slow paced because sometimes you can get confused. Anesthesia and pediatrics I haven't started, but I can tell you that anesthesia is a mid-paced subject for me because I've watched 2 or 3 lectures from it. Next, we have some doubtful subjects, as you can see over here. So these doubtful subjects are, I don't really know when I'm going to study. So these are dermatology as well as psychiatry. And lastly, the preclinical subjects. Like I already told you, the preclinical subjects are going to have 10% questions. So 54 questions out of the 540 questions from the next examination. And these are going to be these 7 subjects. So I'm pretty confident in 6 of them, except for physiology. I am pretty sure I know the remaining 6 ones, and 1 revision or 2 revisions after that, I'll be pretty much done with it, because I have done most of the videos of this in addition 4 itself. So I conducted a poll on Instagram asking what all do you want to know about Marrow, and if you aren't following me on Instagram, you are really missing out on stuff. So when you're free, you can go and follow me on Instagram, and maybe you can be the part of the next video. And one of the most frequent questions I got was, when do I complete a subject, and what decides what subject I want to complete right now? I hope that makes sense. So let's say I want to study orthopedics. Orthopedics is not present in 3rd year. It's a final year subject. So when do I study it? So I would advise that studying while your clinical posting is going on is the best way to learn any subject. Like currently ophthalmology is going on, so I've done ophthalmology in this month, and next month is going to be ENT, but I've already done ENT, so it will be a good thing for me. But let's just say you haven't studied any subject. So the month in which your clinical posting is there, let's say you have a general surgery placement for 15 or 20 days. In that 15 or 20 days, try to, go with surgery and watch the surgery videos, do the surgical part, because with the postings, it is very easy to integrate. And what Marrow has also done is that at every single point where any sort of clinical, scenario is coming up, they have shown the particular image, they have shown everything. For example, last night I was studying surgery, and Rohan sir told us like he saw a case of burst abdomen, which is a complication happening after surgery. So what happens is the rectus sheet opens up and the abdominal contents are visible. So he showed us an image, he told a story about him seeing a case about the burst abdomen. Once you go to your ward and if you see a case of burst abdomen, that will be implanted into your brain. And that is one more thing which I really love about Marrow, is that whenever there is something clinical, they have at least shown an image, shown a diagram, shown a table, done their best to provide us with content. And you might call me a Marrow fanboy, but I really am. I really love the app from all my heart because I've put my heart and soul into it. Right, and what dictates the manner of completion of the subjects is, first of all, I will complete the subjects that really interest me, because if I don't have the motivation, I will not study. So surgery is very interesting to me. So ophthalm, ENT, surgery, all of these will be the first ones to get completed. But apart from that, going with the proper order, do all the subjects which are mentioned in the next examination: medicine, surgery, orthopedics, anesthesia, radiology, ENT, ophthalm, PSM. All of these subjects are the ones which you should complete first if you're in 3rd year. If you're a 2nd year or a 1st year MBBS student, you can live your life life a little bit, start your preparation from third year onwards. I don't think it will be a major problem for you. Right, moving on to the next part of this video, that is what will happen after I'm done with, watching the videos, done with the notes. Now I'm reading the notes. What do I do now? So now I'll be solving and giving questions and giving grand tests. So let's first talk about the question banks which are present in Marrow. So the question banks, that is not necessary that you have to solve it only after you're done with the subject. The question banks are divided in such a way that if you have read a topic, you can solve the question bank for that topic. For example, you have read general surgery, there are a few question banks for that. You can solve that, and you can do that same part right then and there. So what I usually do is that when I'm done with a particular module, let's say I've read general surgery in 3 days because it's a mid-paced subject, and then immediately after that I review the notes, revise in the best way I can, and then wait for at least 1 day. I wait for that particular moment when my brain starts to lose information, and after that I give the question bank. What that does is that it forces me to recollect information, and it's an active recall in that process. Instead of solving the questions right after you're done with your module, I think waiting for at least a day so that your brain starts in that forgetting curve, and then you are able to actively recall it, that will give you a much deeper integration into your mind. That is what at least I feel. I mean, it could be different for everyone, I'm sure it is, but it's my personal video, so I can say whatever I want to. So my strategy for solving question banks is I try to solve at least one question bank every single day, but it turns out I'm really inconsistent. So instead of doing the question bank because I'm afraid of what my percentile will be, what I do is that I make a custom module. So I'll be going over custom modules in just a moment, but let's first talk about the question bank. Let's say that I'm solving a question bank. Most of the times it's going to give me a clinical question. So let's say this is the question and I've solved and I got an incorrect answer, which is what normally happens to everybody. Instead of forgetting that, what I usually do is that I note that question down into my mistake book so that the next time that same question appears, I don't make a mistake in it. So if you don't know what a mistake book is, I highly request you to see this video right over here, which explains the beautiful concept of a mistake book. See, the content in Marrow is so good and the question banks are so versatile that even though I've completed most of the videos, there are going to be some questions which are going to be outside of the videos, and those are the questions which I really don't want to miss, because it might happen that those are the exact questions which come into your NEET examination. So in all, the aim of the question bank is learning is equal to testing. That means I'm learning as much as I'm testing myself. Right, what do I do after solving a question bank? Like I always told you, go ahead and make your mistake book and refine it, because that is the one book which you're going to study a lot, and I can guarantee you that that is the book from which most of the questions are going to be coming, because the examiners like to go on things which student can easily mistake. And I've experienced this because in NEET-UG I made a mistake book. Around 45 questions directly came from my own personal mistake book, and that was a miracle. And so I really want to share this concept of mistake book with everyone. A few minutes before I talked about the custom module feature. What the custom module feature actually is that if you are afraid of the question bank, you solve the custom modules. But in reality, what it basically does is that it allows you the feature of mixing different questions that you have studied, that you have not studied together, and making one question bank out of it, which you can then solve, then share to your friends, and then analyze the data from that questions itself. So my daily objective is solving one question bank, which I've already told you, which I'm not consistent about at all. But other one is solving 3 to 4 custom modules every day. And I can tell you that I do it every single day. It goes even beyond 10 at some days because they are really addictive. So what I do is that I select number of questions, and usually that is 10 because I have 2 brain cells and they get really fatigued if I do anything more than 10. Next, I choose the level of difficulty and then I choose the topic. So custom modules are those things in which I prefer testing myself more than the learning opportunity. Like I told in question banks, my objective was learn equals to test. Here the objective is test greater than learn. What that means is that custom modules are going to be those things which I'll be giving once I have done the subject particularly, or I've done a topic very nicely. So I can make a custom module from that custom topics which I've done and then solve it. What that will give me is that will tell me how much I can actually retain from doing a subject very well in the first read or second read or third read. What it also allows me to do is that I can share that custom module with a lot of friends of mine. So in my group of 10 friends, I have around 6 to 7 people who are using Marrow Plan B or Plan C. So I'm able to share that custom module with those people, and then we can together analyze what our score is. Because my strategy always has been that beating an exam with friends is much more easier than beating an exam alone. And so most of our friends, we all study together and we are very open about what we are studying and how much is our preparation going on. Like you already might know, Abhijit, Aditi, all of these people, they are genuinely open and they genuinely solve all the custom modules that I give to them, and they share the results and share their experiences with me. Right, I'm getting off the topic. Coming back, when do I make the custom module? So I make it all the time, like when I'm in the college waiting for the professor to come inside, I solve a module over there. Maybe I'm sitting in the anatomy parking hall doing nothing, I make one over there. Right before I go to sleep, sometimes I tend to challenge myself with a custom module. Basically, in any point of time where I get some time, I make these modules on my phone and solve them. Do I make a mistake book from them? No, absolutely not, because at some point in the time I will be solving their question banks, and in the question banks the questions will come back again, and from that I'm already making a mistake book, so it'll be twice the work. So no mistake book from the custom modules that I make. A special type of custom module that I make is the fun to do custom module, which basically has 25 to 50 questions from the entire syllabus of your NEET-PG, that is for the moment. And what that does is that it shows me what my current preparation level is. I'm going to get to mini tests in just a moment, so you'll find that more relatable over there. Here in these 25 or 50 questions from all the subjects, I know what are my weak subjects, which subjects I'm good at, and which subjects I'm very excellent at. But of course, these are something which I do just for fun, and there are I don't really do it for the learning part. So here the objective is fun greater than test greater than learn. Coming to the next feature, that is the test. So let's just back up for a second. So we did our videos, we did our notes, we revised them. In all the while we were solving Q banks and custom modules, and now comes the phase of testing ourselves, that is the grand tests and the subject tests and the mini tests. So in between of all this preparation, what I force myself to do every single time there is a mini test is that give a mini test whenever you see a mini test active on the app. So what mini tests are, basically they are 20 clinical questions that you have to solve in 21 minutes. They are going to be mostly clinical scenarios, a clinical vignette where a patient will be given, this is heart rate, this is BP, this is the ECG, what's your diagnosis, what's the treatment. And most of the times what I notice is that the questions are the third degree questions. So what are these third degree questions is that you are not asked about the diagnosis, you are not asked about the treatment, you are rather asked about this is the drug being prescribed, what is the side effect of this drug, and sometimes what will you do to treat these side effects. So this is a third degree question. So this resembles so much like USMLE if you have seen the step 1 questions. So a third degree question is what is seen in the mini test. Plus they are from all the 19 subjects, which also gives me a really good insight as to what my current level of preparation is, because unlike custom modules, this one actually shows you what your actual rank and your actual percentile is while you have studied only half of the syllabus, and most of the major half you haven't even touched. So if you get a great percentile in that, let's say if you're getting a 90 percentile without even reading the major subjects, I salute you because you're a genius. But unfortunately I reach only to the level of 60 to sometimes 80-85 in the mini test phase of solving the mini test. The other type of test that I really want to solve but I'm really slacking on that is something called as the subject test. So these are the tests which are again going to show you the all India ranks. Everything is going to be the same, but this will have much more questions and they will complete one subject in one subject test. I'll give them when I'm done with my mistake book of one particular subject. Let's say I'm complete with the question bank of pharmacology, then I'll do the mini test of pharmacology. What I also like about this is that in the end they provide a a sort of chart which tells you what your current performance is, which subjects you're good at versus in which subjects the toppers are good. So you really get to know how far deep are you in the competition. Do I make a mistake book with that? No, absolutely not. I make a mistake book only with my question bank. Here the objective to judge greater than to learn greater than to test so far. Right, the last type of test is the grand test, and basically a replica of NEET-PG that you have to give on the app. And this I think that every single student should do. In fact, I genuinely think that the question bank of Marrow along with the grand test and every test that they are providing is unparalleled to literally any question bank. I've seen a lot of question banks from all the different apps out there, but I personally feel like the questions which are given in Marrow and the unpredictability in their options is just genuinely, a lot. I've got a friend called as Dr. Darshan Patel. I actually made a podcast with him. He scored an All India rank 2 and he went to Marrow for about a month to make some question banks and help them with developing their content. So Marrow does this thing where they call in the toppers and the topper actually helps to make the content for all of you guys. So if people like Dr. Darshan Patel is making question banks for students like us, I'm pretty sure that they're going to be good, and I genuinely feel like whatever other app or service that you're using, at least go with the question bank and the tests plan. I recently had a friend who was using some other app, but he once he solved a few question banks on my iPad, he just went ahead and bought Marrow the very same day. So when will I be starting this grand test? I'm planning to start the grand test 2022 in January or February when I'm done with my university examinations. Hopefully by that time they'll be done, and hopefully at that time I'll also be done with the final year subjects, because I'm watching the videos as I'm in third year. What are my expectations from it? Absolutely nothing. I'm just going to try it because it's new and I'm gonna have fun with it. Lastly, let us talk about one of the most underrated feature of the app. It is called as the pearls. So pearls are these around 3000 questions which are really important, and these 3000 questions can be extrapolated to form 30,000 questions, because each pearl can give rise to so many different questions. So for example, the pearl number 1, which I remember from Marrow, is I think the culture media for different pathogens. So we have Clostridium tetani, Anibacterium diphtheria, the list of all of these culture media. And what you can do is that you can select a pearl and give the questions from those pearls itself. So pearls, I really want to start it, but again I'm slacking because I'm busy with postings and YouTube and all of the other stuff. But I'll be starting pearls soon enough, and maybe I'll talk about a story where I'll be doing 3 or 4 pearls each day. And you can join me on Instagram at @Anuj Pachhel, and hopefully we can make this journey together. In the end though, pearls will be sort of the thing that I go to whenever I have to revise a certain topic, or when I have to look at all the important things of the next examination, because pearls are beautiful. Right, in the end there are a few questions which I want to address, which I got from my Instagram story. So one of them is how to be consistent and make time for the lectures. So my friend, I am struggling with it as well. What I do is that I have forced myself to watch at least 4 to 5 lectures each day, no matter what. And what really helps is that getting an accountability buddy for this. So for the last week, it was Arya. She's one of my friends, and we made a pact that each day I have to report that I have watched 5 lectures of ophthalmology to her, and she will report that she has watched 5 lectures to me. We are both Marrow plans users, and this accountability with one person keeps you on the track. Because one day she did not do anything till 4 p.m. and then I messaged her, Arya, तुम्हारा स्टेटस क्या है, तुमने किया है क्या? And then she said no, and she's like, मेरा मूड नहीं हो रहा है. And then I told her कि if you don't do it, we won't talk for the remaining 3 days. And then she actually ended up doing 4 lectures, which was very good, because she was traveling and all of that stuff. So an accountability buddy really helps you in staying consistent with whatever that you are doing. And how to make time for lectures, I don't know. You watch it in 3x if you have an Android phone. Go with 2x if you have an iPad. Or I think that 5 lectures, 2.5 hours, I'm pretty sure you can find the time in between. Next is that how to do the textbook reading with Marrow. I personally think that before going into the textbook, watching the videos really decreases the time that you're spending in the textbook itself, because what happens is that once you have preheated the oven inside your mind, you know what the textbook is going to say, and you know the important topics. And then if you go into your basic textbooks, it will really ease out everything for you, and that will decrease the time that you spend in textbooks. Textbooks will be important to study because of 2 reasons. Because if we don't study it right now, there will be no other time in our lives where we'll be going to touch the textbooks. For example, let's say I skip Park for this year, I'm pretty sure I won't be studying Park ever in my life if I don't end up as a PSM person. So textbook reading, now is the time. And second of all, they will give you a lot of insight, and after preheating the oven, it should be easy. The third one is a very important question which I get asked a lot. What time should we buy Marrow, and is it enough for the university examination? I personally think that the mid-second year is the best point to buy Marrow, and at that point you should buy the plan C of Marrow, which will give you access to videos as well. And will it be enough for university examinations? I'm pretty sure that the Marrow videos will be enough for your university examinations, but you also have to use any sort of textbook to get more content to write in the examination, because in India the pattern is the more you write, the bigger the brain you have. So in the end, Marrow will provide you a very short summary of what that topic is going to say, but you will have to read it from your main textbook, at least the important topics, because remaining the MCQ pattern is covered in your Marrow itself. Second is, if you are a first year student, if you want to get ahead in your preparation, I'm pretty sure these guys also have a dedicated first year or second year package. All you have to do is go to this website, marrow.com, and in there you can find more details on that. I really don't know what that is all about. I just know that it exists, so I'm sharing this information with you. The next thing is Marrow Prep Ladder. So a lot of these questions were about different apps comparison itself, and I personally feel like it doesn't really matter. What matters is your preparation in the end. But I would personally say that the QBank and the test of Marrow is unparalleled. It is like something which you definitely should have. But the teachers, they are all the teachers are the top faculties in their particular branch, and it doesn't really matter which faculty which you want to go with. Just go with the faculty in which you understand the most, retain the most, whatever faculty that you go. In the end, what I suggest is that the QBank and test is very, very important for Marrow. Lastly, the physical notes versus the digital notes. This is a thing which I found recurringly in the Instagram story. So the short answer is that for me, the physical notes which I bought, so you can see they are over there. So all of these are Marrow printed notes. What this helped me do is that they helped me focus on the lecture more, and they allowed me to annotate, and I already have this beautiful set of printed notes, and the images which the teacher has shown, they are already printed in it. So why make a copy again? And whatever I want to, I'll annotate that in the printed notes. But of course it differs from person to person. A lot of the teachers says that the handwritten notes is the most important ones. Listen to them if you want to. I'm just a third year MBBS student. I know absolutely nothing, and I already have 2 brain cells. In the end, man, I'm really scared about this next examination coming up, because I really don't know what is going to happen. This is the first time we are going to be appearing for such an exam. Plus I have these businesses to manage. But what happens is that no matter what, I will put my best efforts, and I'm sure you will as well. And anyways, I think that's about it for this video. If you want to be the part of the next video, go ahead and follow me on Instagram @_Anuj Pachhel_, and I'm pretty sure any poll which I add in the future will be considered in this video. So do that. And also, if you haven't already, please consider subscribing. I'll be sharing a lot of my journey of next in this YouTube channel through my vlogs, through videos such as this, and hopefully they will help you make some sort of decisions inspired from me and make your life a little bit better. Anyways, that was a lot of self-promotion. Thanks a lot for watching. It's your boy Anuj. I'll catch you in the next one.